Okay. Well, welcome everybody. I know this is a busy 2 weeks for you guys, this week and next week. You should have all, hopefully at this point, received at least preliminary information on how to schedule your Hesi. Have you guys done that at your campuses?
Yes, I have.
Okay. Mackenzie, what campus are you from?
Westerville.
Centerville? I don't think they have their schedule out yet.
No, Westerville.
Columbus campus.
What is it?
Columbus.
Columbus?
Mm-hmm.
I don't think Columbus has theirs yet. Or do you? Yeah, no, there was two. It was Columbus and there was one other one that didn't have any dates.
Is Cincinnati one of them, Ms. Marvel? Because I haven't heard anything either.
They're starting to come out. Can somebody look at your announcements from this week? Did I have Cincinnati in there? Check with the schedules are starting to come out. So check with your campus tomorrow. Okay. But the dates are starting to get posted of when you can schedule them. I already have some students that already have them scheduled. So just be mindful that sometime this week you need to be scheduling your Hesi. Everybody has to be scheduled for their Hesi. Most are on campus now, but there are a few that are still done by ProctorU. Okay.
I have a question. For Cutler Bay, the schedule has been out, but when I go to Evolve to register for it, I don't have community. I registered already for MedSurg and Peds, but community doesn't come out.
And somebody else told me that yesterday, maybe during one of my reviews. So you need to go back to your campus and get with them. I don't have anything to do with scheduling except provide you guys the date and the time that you are going to be taking it. Make sure you're in the right cohort. But if you've already scheduled MedSurg and Peds, then I don't know why community's not there. What campus?
Cutler Bay, Florida.
Yeah, I think the student I was doing a review with yesterday was from Cutler Bay, and she said the same thing. Same exact thing. She registered for the other ones, but community wasn't there. Okay, so get back with your campus.
Thank you.
Okay, listen to my group, to all of you. I have already sent you out. I sent you out an announcement a little while ago that had Dr. Lundy's review from earlier today. And I'll just say to all the other students, I watched it earlier. I watched it earlier just to get a feel for what information she was providing. And I'm going to go down a different route because Dr. Lundy did an excellent review. It's not that long. It's about 45 minutes long. I'm covering more content. She covers Hesi test-taking skills. Okay, so I would highly encourage you to go and watch her review that I sent out today. And to the other students that are not in my class, she sent it out to all the professors. So your professors should be sharing it with you. Well, that's what we're going to be doing all week. As we do our review sessions, I think there are 9 of them. You have the opportunity to attend 9 reviews this week. You need to definitely attend 1 so you can get your attestation done, which is what you're doing tonight. But then we should be sharing all the recordings with you. Okay, so I've sent Dr. Lundy's out, and I just want to, she does a couple of test-taking tutorials. She goes through them. I sent my classes test-taking tutorials at the beginning of the term, but the 2 she pulled out tonight that you guys at least should have is Basic Principles of Nursing Practice, Guide to Your Critical Thinking. That's the first one. Okay, so you guys should have that. My group should have that. If not, for the other students, you can watch her review and get it. Okay. And then the second one, after she went through that, which is test taking skills, how to critically think about questions, how to answer questions. It was all about test taking preparation. Okay, so this is all that's totally different than what I'm covering tonight. I'm going into content. All right, so again, I highly encourage you to watch her review. The second, after she went through the that basic principles of nursing practice to guide your critical thinking, she then went through the second one, which was critical thinking fundamentals practice questions. And she went through case scenario practice questions that are in the tutorial, broke it all down. You know, how do you eliminate the wrong answer? How do you pick out the right answer? Excellent, excellent. I watched the whole 45 minutes. Excellent. So, okay, so I'm on the record as saying, have a look at Lundy's review from earlier today. Okay. I did something like that last term, but when I saw her do it this term, I thought, no, I'm going to go back to content because she already has put it out there now. The way she is encouraging you to answer questions, break down questions. So I thought I'd add a little bit more to that. Okay, by doing the content. All right, does that help? So go back and watch that. Okay, so here's what I'm going to do with you guys. And I know you guys are tired. We're not going to go the full 2 hours, but here's what we're going to do. I'm going to share my screen. Okay. So a couple of things. One is, well, first let me show you this. These are the PowerPoints. Okay. Okay. So here's what she went over first. Okay. So if you want to screenshot that, that's what she's going to go over. Can everybody see that? Okay. Excellent. Excellent. What? Okay. So that was the first one she went through. And breaking down questions when it says first, initial, best, priority. And then the second one she went through was your critical thinking fundamentals practice questions. Okay, and then she went through all these scenarios. Okay, so I want to pull those up for you. The other thing I sent my group at the beginning that she didn't cover tonight, but I thought was really helpful, and I've mentioned it to numerous students as I've done reviews over the term, is this other one, test taking skills, just general test taking skills. Okay. So again, 10 steps for answering a test question. I mean, you guys should, this should be somewhat familiar to you, but I'm just passing on some resources that you already have to review. Okay. Okay. Okay, here is, I'm trying to decide what I want to do first. Maybe I'll show you how the study guide is set up. Okay, because I want to go through 2 documents with you. Okay, we're not going to go through, it's 56 pages. I'm just going to go through how it's set up and organized. Okay, this should have been given to you towards the beginning of the term. And this is hopefully something you're not opening up tonight or yesterday, or you haven't opened it yet. I don't know. If you're just opening it, looking at it in the last few days, it could be quite overwhelming because it's 56 pages. However, when I show you how it's all broken down and organized, this information, or at least the concepts and the topics, should have been covered during the last 10 weeks. Okay. And then after I go through how this is organized, this is the document I want to spend some time on. Okay. So this is, what do we name this? Hesi topics for students. Okay. As can you see my page? I've gone through this for the last 3 terms. I think it's been really helpful. So we're going to go through this, but this is broken out into community, exam question specialty area, community, vulnerable population, vulnerable disaster, child development, geriatrics, infectious disease. Okay, so how do we come up with this? We came up with this spreadsheet because we reviewed prior Hesis. We took a look at Hesis over the last 18 months to 2 years. And these were the topics that they were asking about. So that's what I want to spend most of my time on, because I'd like to do on this document, I'd like to do what I do in my reviews, which is, okay, if we know they're asking a question about a family eco map, what might they ask? Okay, I don't know what the Hesi questions are. Okay, we do our own exams 1, 2, and 3, but the Hesi is like NCLEX. They pull from a bank. So I don't know what they are, but we do know the topics they're asking about. So I'd like to go through the topics that we know they're asking about. And I have a few more to add that are not on this list that have come up in the last 2-term Hesis. So pretty current information. Okay, so this at least this document gives us a basic understanding of what topics they're covering. Okay, so we'll go through this, but I first want to go back to this and just show you how this is organized. Okay, so I do want to read this first page because it's important. Okay, so obviously it's not an all-inclusive study guide, right? Questions are randomly selected, okay, much like NCLEX. It's hard to predict what questions will be on the exam. However, we've tried to help you guys out a little bit by looking at, or hopefully a lot, by looking at current Hesis to see what the topic of the question is. Okay? And there's nothing you're going to find on that document that's not in the study guide. Okay? Obviously, attending as many live sessions, interacting with me, doing the work in class, doing your assignments, doing your discussion questions, your group projects, your attestation questions. It's all, if you've come to class, done what was expected of you, you should be well prepared for the Hesi. Okay. The one thing that I would certainly encourage you all to do is pull out your last 3 study guides. Okay, before you start going to the book and reading chapters and going back through everything, pull out your study guides. Okay, pull out your 3 study guides, exam 1, 2, 3, and then this study guide. Because you'll find that study guides for exam 1, 2, and 3 are all built into this Hesi. So I don't want you to be overwhelmed when you look at this study guide. Okay, the information in here you should already be aware of. You've already heard about it. Okay, this is just putting 10 weeks of information together. So that's why it's long. Okay. Review your exam study guides for the term. I just said that. Okay, and you obviously have your Hesi study guide. Okay, reviewing, we've gone through this numerous times. ADPI, what's ADPI? It's our nursing process. Okay, priority questions, and you'll get that in Dr. Lundy's review. She goes through that in depth. Okay, so if there's any other review to watch, it's Dr. Lundy's. Okay, she goes through the priority type, concept, safety, and management. Okay, do we all know what primary, secondary, and tertiary is? Got to know that. Okay, remember, physiological trumps psychological. What does that mean? ABCs are number 1. Okay, your NCLEX questions, your evolve case studies have prepared you. Okay, your discussion posts have prepared you. Kaplan, that's this week. You guys are doing Kaplan. You're doing the Kaplan A community. It's fabulous. That is about as similar to your Hesi NCLEX as you're going to find, the Kaplan. Okay. And there's a reason we have you remediate all 30 questions. Even if you got them all right, we still want you to remediate them Why? Because of the rationales. Okay, we want you to read through the rationales. We want you to take notes. Okay? I'm big on rationales. My students know this. Rationales to me are excellent sources of information, right? Hopefully you reviewed your exams with your instructors when the review period was open. Some of you have, a lot of you haven't. Remember to apply principles of clinical judgment, nursing process. The community Hesi is very med-surg focused. Okay, and you'll see that in our little spreadsheet. Okay, med-surg principle, safety and delegation. Remember what you can delegate and what you can't. Okay. So this is broken up into 11. I put this together maybe a year ago. So each header is in red, highlighted in yellow. Okay, so this is broken up into the sections we covered during the term. Okay, so the first header is population groups across the lifespan. Okay, what are the health risks? Okay, so then it goes through, I'm just flying through here. I just want to show you how it's organized. I'm not going to read through all of this. That's your job. Okay, so population groups across the lifespan. Okay, so it goes through all the population groups, infants, children, adolescents, women, men, elderly. So I know this section is a long section, but you have to keep referring back to what the section is so that this all doesn't just ramble on and ramble on and ramble on. This is the section that focuses on groups of population, what their health risks are. Does that make sense?
Yes.
And in this group are US healthcare problems. Okay, so these are continued to be the risks. Okay. This right here on page 11. Well, first of all, here, the bottom of page 10, top of 11, talks about levels of prevention. With regards to risks across the lifespan. Okay. And then here's a nice example that we pulled from the book, levels of prevention related to public health. And again, we're still in that first section of risks across the lifespan. Okay, so that whole first section, so the first 12 pages, okay, are population risks across the lifespan. Infants, toddlers, school-age kids, adolescents, adults, women, men, elderly. Okay. The second section that we talked about was specialty nursing. What did we cover in specialty nursing over the term? We covered the school nurse. Page 12 now, we covered the school nurse. We covered faith community. We covered hospice. So again, none of these topics should be unfamiliar to you. This is pulling it all together. Okay. Third section is the role of the nurse. And here in this section, we talk about family assessment. What's the role of the nurse in doing your family assessment? Here's your information about your EcoMap and your genograms. Okay, I'm on page 15. Our role, we also play a role. Our first role is, well, the first is our nurse's role. The second is how we do our family assessment. And the third is how we're involved in prevention strategies for violence. Okay. And then the fourth is what our roles are of working with vulnerable populations. Okay. Here's again, the role of the nurse. We're still in the role of the nurse. Here's all your ethical principles, which you'll get asked about. I'm on 18. Okay, that's your ethical principles. Next is program management. Okay. And remember, as we're going through as you're reading through all these sections, you need to be able to think ADPI. How is ADPI in all these different topics? How do we apply ADPI in program management and family assessment and nursing education? Okay, so this next section is all about the program management. Give some more examples here of primary, secondary, and tertiary. Aspects of program evaluation, evaluating outcomes, assessing risk. Next section is infectious diseases. Okay, remember the epidemiological triangle? The agent, the host, and the environment. Guys, remember that?
Yeah.
Okay. And it goes, this section's infectious diseases. So it goes through the epidemiological triangle. It goes through CDC reportable diseases. It talks a lot, previous Hesis, every Hesi we see has questions about TB on it. So we've added additional information about TB as far as how do you apply the test? How do you interpret a positive test? Okay, what's the difference between endemic and epidemic? Okay, we'll need to know the difference between those. Next section is disasters. What's the difference between man-made and human? Okay. What's the role of the nurse? And again, you've gone through all of this over the last 10 weeks. This is just a summary of everything you've gone through with a little bit more detail. So between your 3 study guides and this study guide, that's what you need to be focusing on. It goes through the 4 stages of disaster, right? Preparedness, recovery is the 4th, but preparedness, response, recovery. Okay, and it goes to all of what our rules are, recovery is all these stages. Okay, here's your levels of prevention with regards to disaster. Okay, I'm on page 34. Talks about different kinds of disasters, terrorism, bioterrorism. What's the role of the nurse? We're a little bit more specific in this study guide because we've seen questions that relate to bioterrorism agents. Okay, so we've broken it down for you. Okay. We've seen questions with regards to triaging. What are the levels of triaging? And that's on our spreadsheet that we'll go through. This is an excellent section here on page 37, which is the review of disaster nursing. This is a good section. I want you to read through that. Nice summary. And then I highlighted cholera in disaster situations because one of the things that came up in the last couple of Heses that wasn't on our spreadsheet that we saw was the mass flooding in a disaster. And the question was about diarrhea after mass flooding. But what is that? Right? That's your cholera. Right? Issue with water. Okay, so maybe that question is, what does cholera cause? I don't know. Does that make sense? Okay, here's all your triage information. The next section is culture. Okay, I'm big on culture, cultural competence. How do you get there? How do you become culturally competent to take care of all different kinds of patients from different cultures? Okay, and how do you get there? How do you check your own beliefs and values? Okay, so this next section is on culture. Excellent section. Just breaks it all down for you. Nurse must be culturally competent for several reasons. Love that section. 3 stages of developing cultural competence. Okay. So there's your culture section. Rural versus urban. We talked about this, right? Okay, so have a look at this. You do need to give this study guide a good look. Okay, you can't just, go from your 3 other study guides. This is, if you review your study guides and then look at this, there shouldn't be a lot of additional information. This is just a super version of your 3 study guides combined. Okay. Next section is federal agencies. We went through lots of those over this term. Okay. The important federal agencies with regards to community health, public health. Okay. And that's it. I think that's your study guide. No, yeah. Nope, we have one more. Community assessment. How do we do a community assessment? List down here. Community assessment. Okay, we talked about, so during the term, we've talked about individual assessment, family assessment, community assessment, population assessment, right? Lots of different kinds of assessment, but community assessment was a big one. Okay, how do we do a community assessment? You need to think ADPI. Okay. Occupational issues when we're doing a community assessment. Difference between Medicare and Medicaid. So again, a lot of this is, that's it. A lot of this is in your, a lot of this information is in your 3 study guides. Okay, so again, if you've looked at this, that's great. The reason why we give it out early in the term, and we say this, not that people do it, students do it, but some do, that they use this throughout the whole term, and they kind of highlight and check off areas that have been covered each week, so that when they finally, pull it up at the end of the term, it's all kind of highlighted and checked off. Does that make sense? So don't get overwhelmed if you're just looking at it now or recently. It is a compilation of your 3 study guides. Okay, it's just more detailed. Does that make sense? Let's go through this Excel document and let's go through the topics. And this is where I want it to be interactive. So anyway, does that help to break down the study guide? Those are the major topics that we covered over the term, broken down into headers. Is that helpful?
Yes, ma'am.
Yes.
Okay, don't get overwhelmed with it. It's information in there you should have already heard. If you've been participating in class and doing all your assignments, it should not be not familiar to you. Did I say that right? Should not be not familiar to you. Yeah. Okay, let's go to this Excel spreadsheet. So, like I said, for those of you that came in a little bit late, please make sure you put your name and your instructor in the chat box, because I have to send off attendance to all the other professors when I do I am recording, right? Yeah. Okay. So this spreadsheet came about maybe 3 terms ago, 3 or 4 terms ago, maybe 3. We reviewed Hesi's for that previous year, and we keep reviewing Hesi's. Okay, so we have come up. So this has probably been over 18 months. So this is a list. We've got 2, 4, 6. We've got six topics down here. And we try to kind of mimic your study guide as well. Okay, to break it out into those topics. And these are, we have no idea. We don't pick the questions for Hesi. Those come out of a bank like they do with NCLEX. And I know some of you have already heard me said that, but this is for the ones who came in later. Okay, so all we can really look at is the topics that were covered. So what I like to try and figure out is, or help you figure out, is what kind of question might they ask? We can't see the questions. Okay, so let's start with community. So for community, we know that they were asking about an eco map. What is an eco map? And what question might they ask? What's an eco map?
Isn't the family interactions?
Yep. Social interactions. Yep. Family. Yep. And so what kinds of questions? What could a question be? Do you want the family socially active or socially inactive?
Active.
Right. Okay. Voluntary agency. What do you think that might be about? Remember, the topic is community right now. Voluntary agency. What about your partnerships? Active partnership, passive partnership, right?
Yes.
Working in the community. Make sense? I'm trying to figure it out just like you are. I don't know the questions. I just know the topics. What about program goal setting? What might they ask about that? What's important to remember about program goal setting? Anybody?
I'll take a try.
What?
Go ahead.
No, go ahead.
Oh, I was saying to I guess include the community and goal setting so that they'll work towards helping you with it.
Mm-hmm.
That's what I was going to say.
Think
like
of your ad
knowing
pie.
Right. Knowing what community you're working with, know maybe past data on the needs or know the needs of the community.
Yeah. Yeah. Advisor role, leader. Don't pay attention to any of this community. The front here. I'm going towards the end where that's the real specific information that's being asked. Advisor role. What do you think? I'm thinking maybe advocacy there. What do you think about that? What's an advocate? Why are we advocates? What do we do? What's an advocate?
Supporting your client or patient, standing up for them, possibly when they can't, knowing what they need and helping them get what they need.
Yeah.
Maybe like a case manager.
Yeah. Perfect. Yeah, exactly. Exactly. Okay. Outcome evaluation. What's that all about? Remember your ad pie. Why are we doing outcome evaluation?
To make sure that the interventions that have been used are effective.
Exactly. Exactly. You always have to do evaluation. How are you going to know if what you're doing is effective? Whether it's a training program or a education program, outcome evaluation is all you're always doing that. Okay. And I believe it's in the program. It's in that second or third section of the Hesi study guide. What was the header? Program development, I think. That's, I think, where you're going to find your information on outcome evaluation. Here's your community risk findings. I'm thinking that's probably in that first section where we're talking about risks across the lifespan, right? I don't know what they're asking, what age group, what population group, women, men, infants, children, but be familiar what the different risks are, right, in those populations. Right. I know that for young kids, it was accidents. For infants, it was SIDS. For adolescents, it was, I think, obesity. So just have a look at that first section, know what the risks are. Okay. Blood pressure screening in healthy people. What do we think that is? Maybe that could be a primary, secondary, tertiary question.
Mm-hmm.
Right?
Probably secondary. Because we're screening them.
Yeah, it's secondary. Yeah. So maybe that's a one of those intervention questions. Here's a med surge related question. Cardiovascular, exercise and hydration. What do we think they're going to ask there?
How to promote healthy lifestyles to prevent cardiovascular disease.
Mm-hmm. Maybe signs and symptoms of dehydration. I don't know. Maybe how important it says exercise / hydration. Maybe how important it is to stay hydrated when you exercise. And then radiation exposure. What do we think they might want to know about radiation exposure? I don't know, maybe signs and symptoms of radiation exposure, how you can be exposed, how to prevent exposure, how to recognize exposure, right? What else? What else do you guys think with regards to radiation exposure? Or did I cover it?
I was wondering maybe it was academic logic triangle maybe going around trying to figure out what's the host or the agent.
Absolutely. Yep. That's an excellent point. That hasn't come up in my reviews before, but that's an excellent point. Maybe they're asking about, how it is the radiation, is that an agent, host, or environment? If it's an agent, how could it potentially affect the host, and what does the environment have to do with it? Yeah. Excellent. Okay, so those are some of the topics they've covered under community. Okay, next is vulnerable populations. Okay, again, don't pay attention to all this in the front. It's all just the area that it's in. Okay, although I will say that again, you look at you got hepatic, you got med surge, you've got med surge questions in here. Okay, so homelessness, cold exposure risk. Well, what do we think they want to know there? Maybe what are signs and symptoms of cold exposure risk? Cold or exposure? What else?
Maybe focus on a prevention from that happening, maybe?
Or prevent, or maybe how do you work with it after it's happened? They've been exposed, so that tertiary, right? Either way.
I'm thinking too, with it being homelessness or whatever, what are some ways that we could possibly help those that are homeless? What materials would you possibly give them to help them, not be exposed to the cold weather? Rather handing out gloves, blankets, hats, coats.
Yeah. And maybe what would exposure look like? What might they present to the ER with? Migrant. Okay, next it's a med surge question regarding respiratory. What do we know is a migrant respiratory risk?
Pesticides.
They are exposed to chemicals and pesticides.
Yep. Bingo. Community resources in the rural area. What do we know about that? We know that they're pretty scarce, right? Can you guys see me? My screen is frozen.
I can see you.
Yes, I can.
Okay. Can you hear me?
Yes.
All right.
Yes.
I'm frozen. Looking at myself, I'm frozen, but as long as you can hear me. My community resources, they're stretched, right? Not a lot of specific resource specialty, right? So maybe knowing about what's the difference between community resources rurally versus urban. Okay. Next is a cultural, spiritual question. And they're talking about the Hispanic population. What might they be looking for here with regards to cultural, spiritual?
Understanding what that population or group of people, maybe their spiritual outlook, like what is their preference when it comes to religion or
yeah,
possible holistic medicine or whatever.
Yep, that's great. That's awesome. Anybody can feel free. I know we've got lots of people in here. I've got 20 people in here. So anybody else that wants to jump in, feel free to jump in. Okay. I'm unfrozen now. Okay. Next one is Islamic faith. Kind of same thing, cultural question. Cultural competence, right? We're going to be working with lots of different cultures in your nursing career. Okay. Culturally sensitive teaching, what do we think that's about? I have a thought on that. I think that maybe we need to be mindful as nurses when we're teaching to different cultures. What could we do to be prepared for all the different cultures and being able to teach effectively? What should we be doing as nurses?
Checking your own cultural beliefs and putting them to the side.
Mm-hmm. What happens if we're not culturally sensitive? What are some issues? Maybe misunderstandings.
That's going to be and there be non-compliant.
Mm-hmm. It is imperative, and my group knows this. I really, really honed in on this being culturally competent. In this day and age, with all the different cultures that we are working with and exposed to, there's no wiggle room. Okay, there's no wiggle room. We have to be culturally sensitive, right? In our communication, in our teaching, in our practice, right? Next topic or subject was anxiety, abuse, battering communication. What might that be about? Maybe how to identify what abuse
looks like,
sounds like, feels like, presents like. Right, so maybe that's about, you hear somebody say something, I don't know, and you're given a phrase or a case scenario and have to identify, what's normal and what's not normal. So that would tell me that the signs and symptoms of abuse would be something that you would want to be studying. Next, depression, grief, with regards to home health and the dying client. What about that? That's going to be your hospice nurse section to review, right? What might they want to know? What might they be asking you to know about that?
Maybe the different stages of depression and grief, maybe?
Role of a hospice nurse? I mean, these are actually, go ahead.
I was saying, what to teach the family about dying and grief.
I remember that exam question we had about what do you do if a family member is not on board? Remember that? Just throwing this out there. I'm trying to figure it out just like you.
Okay. I like to ask questions like, how do you respond? Family member or family makes a statement. How would you respond? That's, it seems like they give a lot of that.
Yeah.
Like, do you be quiet? Do you just listen? Do you just let them talk? Stuff like that.
Okay, what's next? Geriatric, probably med-surg question. Depression, grief, nursing skills, nutrition, goal setting. So what might that be about? That's a lot of categories there, but geriatrics, depression, grief. I mean, that's your elderly population of, how do you identify when they're depressed, right? What are the signs and symptoms of depression in the elderly? How do you help them set goals? I mean, this is all, each line here is a topic, a question that's been asked about this topic. So I hope you find this helpful. These are the things they're asking about. This is taken from Hesi's. These topics are taken from Hesi's over the last 18 months. Okay. Home nutrition, geriatrics, home nutrition. What are we thinking there? Maybe how to assess for accurate or making sure they're eating properly. What about different kinds of diets?
Yeah.
What else?
Disease,
What?
according to every disease, the different diets that the nurse has to handle.
Last one, psychiatric, mental health, and pediatrics. Abuse, health department visit. We talked about that in class, you know, maybe voluntary visits versus involuntary visits. That's what I think of when I see this, right? How do you recognize the signs of abuse? And it's in the section of pediatrics, so it's probably talking a question about child abuse. Maybe it's about mandatory reporting, right? We all know that we're mandatory reporters, right?
Yes,
And
ma'am.
are we mandatory reporters just at work?
Nope.
Where are we mandatory reporters? Anywhere?
Where we go.
Grocery store? Park? Right? Okay, disaster. Let's go through a couple of things here. Natural disaster preparedness. I don't know, could be many things with that. What is a natural disaster versus a man-made disaster? Right? First stage is preparedness. I don't know, preparedness is listed here. So maybe we should know about, maybe we should review the section in our study guide, the disaster section that talks about preparedness. Maybe what's the nurse's role in preparing? What else do you think?
Thinking about we were just tested over was considered natural. How do you prepare? What would you teach a class on preparing for a disaster?
Yeah. Oh, remember you're in exam 3. What's a disaster kit? Right? How do you teach to be Red Cross ready? Right? How do you put together a disaster kit? So that's good. I hadn't thought about that. That's good. Yeah. That's a good possibility. And then here's the question about your cholera. What's cholera? How do you get cholera? What's it from?
The massive flooding.
From flooding. So it's, what is it? Dirty water. And what are some, no, I would read about cholera. It's in your study guide. What are some, what is it? Vomiting, diarrhea, what else? Gastro, GI. Right? And then here's that triage. That's why I was talking about triage when we went through the study guide. This is saying that they were asking that on the Hesi there was triage. They want to know about red tag triage. Okay, so you need to go back into that section. There are 5 tags and what each tag is for. What's a red tag? Anybody know?
Immediate, like immediate use of labels.
No, red tag is.
Isn't it urgent?
red tag is,
Immediately.
hang
Just to
on, I thought,
categorize which
I
patient
think
needs
red
to be-
tag is deceased, isn't it?
Yeah, they cannot survive
What?
without
Yeah.
No,
immediate
this is black.
I
This
thought
is black.
deceased is
Hang
black.
on, hang
Yeah,
on.
it's black.
There we go.
but
Oh,
have a
sorry.
chance to survive.
Red tags, immediate. Those who cannot survive without immediate treatment, but those who have a chance of survival. Okay. But I would, I'd know the 5 tags. Okay. Symptoms of possible terrorism. Okay. That was in your study guide. There's a section in your study guide that's endemic versus epidemic. That's where that information is. Okay. Child development, screening programs. What do they want to know there? I don't know. Or maybe screening programs, are they primary, secondary, tertiary? You already know the answer to that, right? Maybe what kinds of screening programs for who? Maybe kids. What do we screen for with kids? It is the heading is child development, right? Exam question, specialty area, and topic, child development. So maybe what screening programs do we do for kids? I know in the schools we do vision and hearing. Some schools do height, weight. What else? Scoliosis. What else do we screen for with regards to child development?
Vaccine status.
Yeah. Mm-hmm. Yeah. Okay. Teaching about diet and stress. And remember, we're talking about kids here, child development. What are we thinking there?
Obesity, maybe?
Possibly. Maybe teaching about not stress eating. Maybe teaching about ways to reduce your stress so that you don't overeat, or how stress can cause overeating. I don't know. What do you think?
Change their sedentary lifestyles to more active lifestyles to improve their
Perfect.
their physical health.
That's a great thought. Yep. Next one, heart healthy diet. What do we think that's about?
Teaching what foods are good to eat and what aren't.
Mm-hmm. Remember that question on the exam about if a parent says, what would a parent say? What would a parent say that would be concerning to you? Remember that question on exam 1? And the answer was, if they say, oh, don't worry, we use 100% fruit juice with all our meals. Remember that question? That was the wrong answer that the parent gave. Right? So that's from heart healthy diet. So you're right, teaching the family at early stages what is a healthy diet. Okay, here's your teaching. It's in the lines 6 and 7. Okay, pre-adolescent teaching, adolescent health teaching. Go back to your study guide, the first section where it says risks across the population. There's a section on pre-adolescent teaching, what we teach them, and what are the main things we teach about. Oh my gosh, my battery's low. What am I doing here? Oh, Maybe I should plug it in. Huh. Okay. Where's the teaching? Okay, so here we are with adolescents. Okay, and where's the teaching? Here, education. Okay, here's the things we do with adolescents. Okay, what was the other group that we just mentioned?
Pre-adolescent.
Okay, so let's school age children right there. Okay, so there's your education with that group.
I have a question.
Hmm?
Okay. I noticed that because I talked to Dr. Lundy, we had a meeting, and she was saying that basically, like as far as us like preparing like Hesi questions, NCLEX or whatever, the only thing she gave me was the our assignment that we're doing this week for Kaplan A. Is there any other areas that we could do practice questions? It's maybe an NCLEX or Hesi. I'm just
Well, you've already
asking.
done 200 NCLEX questions.
Okay.
Right? You'll do your 30 Kaplan questions.
Okay.
She'll do in her review, she does 10 practice Hesi questions with you. You have a whole bunch of Kahoots. You should have a Kahoot for every week.
Well, maybe we're not getting all the goods because our getting all the Kahoot deals. I'll go back and look, but I know some of them was only up temporarily. It wasn't like up and stayed up. It had a time stamp or date stamp on it.
Okay. I thought I sent out Kahoots weekly. Did I not do that, guys?
Yes, ma'am. But like she's saying, it's timestamped, so like you can't
They
go back and do
expire.
weeks. Yeah, they expire.
Well, no. We figure out a way that you mean when you go into them, you're on the podium. Is that what you're talking about? They're already, oh, I see what you're saying.
Yes, ma'am. You're on the podium already.
So we need to go in and extend those timestamps, right? So that they're accessible the whole term. Why do they have timestamps? Okay, I'll deal with that. Okay, does that help, Frankie? Does that help? Oh, well,
Yes.
Hang on. You guys just, we sent out, or I know I sent it out. We sent out the Hesi practice quiz and the Hesi practice test. Did you not get that?
I'd seen some stuff announcements for this week and maybe last week.
Yeah.
So I'll go back through and just comb back through those things.
Yeah, I can only see a few people, so I'm going to ask Margarita. Margarita, hi, I can see you.
Hi.
I sent out, there were 2 links. One was a Hesi practice quiz, and the other one was was it NCLEX? I'll have to go back and look at an assignment.
I haven't seen that.
What?
I haven't seen that.
Hang on.
I saw it.
Hang on, guys. I'm just going to go back to a class.
Maybe I haven't checked it.
I'm just going to go back to one of my classes. Oh, did you guys see the Hesi Jeopardy?
Yes, ma'am.
I seen it today.
When you click on it to see the answer, it's not releasing the answer.
It's what?
When when I read the questions and it says like click the link, it says something like click see answer. The answer is showing me any of the answers.
Right. It like shows up under it. Like
it shows up under it, but it doesn't allow you to click it.
I've had a couple of students that I've done reviews with in the last couple of days that have already gone through the Jeopardy and didn't say, they said it was actually good. They didn't say they had any issues. Is everybody having that issue with the Jeopardy?
I know I had the problem. I don't know about others. I tried it today.
Yeah, I did too. What she's saying is when you click on it, it doesn't like turn around, but the answer is like under it. It's not like, yeah, you click on it and it flips it over or anything like that.
Right. But the answer is.
It's not showing me the answer at all. Like it's like click something. It's like click to see answer. And when I click it, it's not doing anything like even showing the answer at all.
But what it is under it, like it's saying for $100, click this, but then when you click it, it doesn't flip it over. But then under it, it says answer for $100 and it answers the question above it.
Mm-hmm. Mm-hmm. Yes.
Does that sound about right?
Yes.
Okay. Not mine. When I go, I'm gonna go and see real quick because I know when I tried it today, when I did it, it just kept like when it said when I went on there to push the answer, it wouldn't show me the answer at all.
No offense, but Professor Marble, once you click one and just like click that and just see if it'll let you do it, so then you'll see what she's talking about.
I don't. I'm on it now. I'm gonna see if it let me do it, but it wasn't doing any of that. Maybe because I was on my phone. Maybe I'm not for sure.
Oh, I would try it from your computer.
I'm doing it.
Here's what I sent my group. Practice Hesi activities, and here's a practice quiz and a practice exam. So Frankie, you're asking for other resources, other questions. This is it.
Okay, thank you. Yes, I got you. Thank you.
Okay, you're welcome. Okay, let me get back to where I was. Where was I? I was on our spreadsheet. Okay, let's see. Healthy People 2020 Adolescents. What do we think they're going to ask there? What are the goals? What are the objectives for Healthy People 2020 with regards to adolescents? You'll have to go back to that chapter, right? Or go to your study guide. Seatbelt safety in adolescents. Well, we know that we learned in class that the accidents, right, are the leading cause of adolescence, right? And those are the kids that are just getting their licenses. So teaching seatbelt safety. What else do you think there? Anything else you could think that could be asked? What about neighborhood safe houses? Why is that coming up? What's important about that? Okay, next, nicotine. There's a question about nicotine. Maybe
try to get them to stop smoking. Maybe, I don't know.
The health risks of nicotine. Trying to educate primary prevention. Trying to educate on the dangers of smoking. Same with the next couple of lines. Lice. I don't know what they're going to ask about lice, but particular, what?
Screening about lice.
Screening, right. Treatment. Assessment. How do you assess for it? Skin health. With
interventions.
Huh?
Nursing intervention for lice. What the nurse should do in the school.
Mm-hmm. Mm-hmm. Yep. I think when I think of skin health with child development, I think of eczema, acne, maybe. Scoliosis, ADHD, Eczema is here. Immunizations. Immunization rates. I'm just going through the topics that we're seeing. Immunization rates. What do we know about immunizations? What's the no shots, no school, right? No school, no shots. No shots, no school. That students have to be immunized before they come to school, or they have to have their exemptions. Okay.
The important vaccines for adolescents.
Mm-hmm. Yeah. There was a question identified that talked about the hepatovax B allergy, and in parentheses, an allergic reaction. So I don't know, maybe they're asking, what does an allergic reaction look like? Or what's the incidence of hepatovax allergy reaction? So be familiar with hepatovax B. Okay, conjunctivitis. Ophthalmic medications, family assistance with ophthalmic medications. I don't know, maybe that means they can't afford it and you need to try and help them find resources to pay for their ophthalmic medications, or help them find insurance so they can be covered. What else do you think? And then the last here is lead poisoning. What did we learn about lead poisoning in class? Maybe what the sign
affects children.
Pardon me?
It affects children. It's hard to keep them off the grass because they're children. They want to go play on the grass.
Mm-hmm. What the signs and symptoms are of lead poisoning? Where do you find it? What do you do about it? Okay. Okay, geriatrics. So this is this section's focused on a lot on med surg here. Okay, how do you do an elder health assessment? I always think about doing an elder health assessment and doing maybe a risk assessment for them. Health assessment, risk assessment, environmental assessment, abuse assessment, many kinds of assessments we can do for the elderly. Okay, screenings, community senior health screenings. What about skin health with the elderly? Med surg question. What do you think they might want to know there? Maybe how to assess for skin breakdown. What does skin breakdown look like? Why is there skin breakdown?
Identifying when we get older and our skin is thinner, you know, people bruise easily. What would you be looking at if you saw old bruises opposed to new ones?
Excellent. Yep. Line 6, home environmental safety. So your safety assessment. What's good and what's not good, right? We talked about that. The skidding mats, you know, the furniture in the way, the temperature in the refrigerator not working, right? That's your environmental assessment. Hazards, risks. Home care referrals. When do we do referrals? Safety for the elderly. family assistance with ophthalmic meds. I think that's probably, again, your Medicare versus Medicaid and getting them assistance. Hygiene, diabetic foot care. What's that all about? That's a med surg question. What's that about? How do you do diabetic foot care? When do you do it? What else?
Or maybe they shouldn't be doing it. They need to go to school.
Exactly. Yeah, exactly. How do you care for a client with Parkinson's? I'm on line 12. And there was a question about orthostatic hypotension. I could think of 10 questions about that. Right? When are you at risk for it? What does it look like? What do you do? Think of your ADPI. Okay, and here's one: secondary prevention, it's underlined, with hypertension. That'd be pretty easy. So what are we doing there? Secondary. So what are we doing?
Screening.
Screening for hypertension. Absolutely.
Would that also be like a follow-up, like following up with your provider, and, you know, making sure that you're going to your follow-up appointments and stuff like that? I'm just asking because sometimes it gets tricky.
Yeah, I mean, tertiary obviously is if you've been diagnosed with hypertension, because then it has to be managed. So, you know, following through with doctor's appointments, I guess if you don't have it yet, that would be considered primary, right? Because you're going to your, right, for routine blood pressure screenings.
So what was secondary prevention? What does that look
Well,
like?
secondary prevention would be your screening for it. So let's say you had an elevated blood pressure, but it wasn't considered hypertension. So that's something that you want to deal with right then in secondary. You've been screened, you're at risk for it, and now we want to manage it so that it doesn't get into be a diagnosis of hypertension.
Okay, I see what you mean. Right. Like if it was elevated before and you go back, like follow up, your doctor says, we'll see you in 3 months, and they want to check and see how your blood pressure is doing.
Exactly.
You haven't been diagnosed. Gotcha. Thank you.
Yep. Line 15 is cardiovascular disease in the specific population of African Americans. What do we know?
Dominant race to get it.
Exactly. Why are they asking about lipid screening?
Because they go hand in hand with the cardiovascular CDA.
Exactly. And we get down to influenza. We're talking about the elderly. Vaccine, home care, elderly relocation. Remember the question about that in the exam? What are the risks when the elderly relocate? Let's say they go to their long-term care facility, their kid's house, whatever, they've relocated. Remember all the issues that can arise? Changing doctors, confusion, right? So what risks does elderly relocation pose? Next one, client with COPD. What are the ADLs at home with a client with COPD? Long-term care fall prevention. Community resources for the elderly. There was even a specific question regarding Meals on Wheels. I don't know what the question was, but maybe what kind of resources are out there for the elderly? I don't know.
What was the one before that? I'm sorry. Before the Meals on Wheels, the community resource.
Community resource. Meals on Wheels. There was ascites. You know, a home diet with regards to ascites. What do we think that's about? Are you having to teach a different kind of diet when a client has ascites? Anyone?
Can you repeat the question?
What do you guys think? If a client has ascites, you are going to be teaching about a different diet, are you not?
Yes.
Yeah. Cancer, primary prevention, cancer. What might that be? Teaching about the risks of cancer, the risks of, if it's a primary prevention, you're trying to prevent something from happening, so you're doing education for prevention, right? And the last section is infectious disease. Let's see what they're asking about here. Okay, newborn, vertical transmission, what's that about? We talked about that in class. What's going to be a risk for vertical transmission in newborns, from mom to newborn, right? Remember, the topic's infectious disease. What are vector-borne diseases?
Oh, so like HIV?
Mm-hmm. Syphilis, STDs, sure. What are vector-borne diseases? Ticks. What else? Mosquitoes. They'd like to ask you about what are CDC reportable diseases. There's a long list. I can't imagine you have to memorize that list, but maybe there's a list of some pretty obvious ones that are the CDC reportable. Or maybe
Sickle cell.
Yeah.
Chlamydia, maybe.
Yeah, exactly. Endemic symptoms, possible terrorism. Okay, so go back to your study guide and look at the endemic section. And there's also a section in your study guide about anthrax. Okay, there was a question about anthrax incubation. I don't know what the question was, but maybe how long, what's the incubation period? What are the signs and symptoms? Okay. And then SARS, your respiratory, your reproductive, your pelvic inflammatory disease risk factors. Line 10 is your epidemiological triangle. '11 is flu vaccine. So these are questions that were asked. TB, the last two are TB. That's why we expanded our detailed information given to you with regards to TB. It's all in your study guide. How do you do a skin test? When do you read it? What's it supposed to look like? What's the follow-up? When do you do a screening x-ray? Okay. So that's my little cheat sheet for you guys based on a review of previous Hesis. Helpful?
I think it's very helpful.
Should be real helpful.
Exactly. I'm like, just that review sheet has everything on that sheet that's on your slides that you're using.
You mean the study guide?
Yeah, the study guide. That's what
Study guide
it
has
has
everything in
everything.
there.
You just
We built that study guide around the topics that are presented in the Hesi. And we built our teaching in our class around, what's covered on the Hesi. So your Hesi study guide is a pretty detailed study guide. I think if you start by reading your 3 exam study guides and then go through that Hesi study guide, I would just go through. You're just going to have to take a couple hours, go through it page by page, check off or highlight what is completely foreign to you, and maybe highlight, yep, got this, know about this, got this. And then when it's all said and done, see what stands out as 2 or however many, 5 things that I need to go back and research that. I need to go back and read about that. I remember talking about it, but I need to go back to that chapter and find that and read it in a little more detail. That's what I would do. That's what I tell my group to do at the beginning of the term is if you have a minute, well, I tell them to do that with your study guides. Try and go through your study guide within a couple of days after class. Go through and highlight what's been covered. And therefore, by the time you get to studying for your exam, everything's highlighted. Yep, they went through that, they went through that, they went through that. That's why we give you the Hesi study guide early on. So you can start knocking stuff off of that. Yep, covered. Didn't really understand that. Need to go back. Oh, still don't understand it. I need to contact my professor and set up a time to meet. Okay. So just trying to prepare you guys the best I can with the information that I have now. And I think that spreadsheet is extremely helpful. And everything on that spreadsheet is, at least the topic is introduced or covered in the study guide. Questions, comments, feedback. Helpful review session?
Now, will there be math? Sorry.
Pardon me?
I just wanted to know, will there be math on there?
No math in the Hesi.
Okay. I was just thinking maybe it would be. I'm sorry.
Any other questions? Put your, if you haven't, put your name in the chat so I can send this off. I'll post this recording in my sections. Hang on, I can stop recording now.